here for some offline classes, and then I had to reach studio sharp at 8 o'clock. But Hyderabad, as you know, is a mega city, right? It's a metro city, big city. Now, while navigating through the different areas, small roads, in roads, I landed up on a wrong location. From there, again, I have to come to the studio, and obviously that would take some time, right? Now here I'm in the studio and we're doing this session. But there's an important lesson to learn from my mistake. I'll tell you what is the lesson. I have already told you Hyderabad is a huge city, and two mistakes happened from my side. First one, I started traveling uncharted territory, right? I did not acquaint myself with the map of the Hyderabad. I did not calculate the distance to be traveled and time to be expected. And also I did not look at the expected traffic. Big mistake, right? Mistake number two, I did not start well in time. लगा कि हाँ आधे घंटे में 45 minutes में पहुंच जाऊंगा स्टूडियो and I will be able to do the session. But this is the same set of mistakes that we do when we get into MBBS. We think that dhire dhire we will start studying the clinical subject somewhere in the final year and we will be able to get it done. Nahi hoga. Same thing that happened with me will happen with you with respect to your MBBS preparation. Number two, medicine is as vast as Hyderabad city, right? You open Harrison and arrange all the pages of Harrison, maybe you will be able to cover some part of Hyderabad, right? So when you have such vast syllabus, the best way to complete it is to start early. If I don't start early, I will not be able to finish, right? जो मेरा हाल आज हुआ, वही आपके साथ भी हो सकता है. So if we don't want to go through that, then we need to have a planned approach to medicine. Now I'll tell you one survey that I conducted among my students. Those who cleared NEET PG, right? Even those people who cleared NEET PG and who are doing their residency right now in different subjects, 1/3 of them did not study medicine at all. Because by the time you become intern, post-intern, you start thinking that, okay, medicine is something which I will not be able to complete. Best bet is that I will leave it and I will concentrate on the other subjects. I'll try to finish them and then get into my NEET PG. कैसे भी करके आप एक rank निकाल लोगे. But when I talk to those students now, I learned two important observations. The first one, most of them suggest that, sir, थोड़ा बहुत medicine पढ़ लेना चाहिए था. I should have studied a little bit of medicine. ताकि whatever specialty I'm doing today, I would have been at ease, right? You may be doing orthopedics later, you may be doing emergency medicine, you may be doing obstetrics, you may be doing surgery. Everywhere the knowledge of medicine is essential, right? When you are in emergent situation and you don't have access to the medicine PG as a surgery OBG or ENT opthal PG, you might have to take some quick decisions. And you might struggle to do that if you don't know the basics of medicine. That is one observation. Second, consistently, all the students agree that if they had spent little time with medicine, they would have had a better rank. They might have landed up in a better college now, or they might have landed up with a better branch, maybe their dream branch. Many of them got some seat, but not the dream seat because of some lack of marks, and medicine, ignoring it is also one of the reasons, right? So that is why we're doing this session. So first thing is, what I want you to understand is a question. Should I start studying the medicine? I'm telling you repeatedly that yes, medicine is an important topic and we need to study, but the question is, should I really start? The answer is big yes, we should start studying the medicine, right? I had to come late to the studio because I did not start from my hotel. I started late, I reached late. You start late, you finish late, or you may not be able to finish at all. Starting early as soon as possible is essential to finish medicines like that. And please remember this quote. This quote helps you to understand the importance of starting first. Starting is the biggest trouble, right? The quote says, you don't have to be great to start. You have to start to be great. According to Zig Ziglar, you don't need to be really great to start. Don't start thinking that, okay, I will get going with my second year subjects. I will get going with my third year subjects. I will get mastery on the second year subjects. I will get mastery on the third year subjects and then I will start. It doesn't work that way. As soon as you start your second year or third year, start studying for medicine as well as surgery and OPGY. This is the right time to start. The early starters always have the advantage. So first thing, let us convince ourselves that we need to start. Starting is the biggest trouble. Once you start, you will be in the flow and you will get going. And then let me address the second most important point. Why should I start in the second year itself? Why not third year? Or why not fourth year? Starting is important, but why in the second year itself? I'll tell you two benefits of starting in the second year. The first benefit is I call it as compounding effect. Now, what do I mean by compounding effect? I'm sure all of you are Instagram crazy people, right? Your generation is big fan of Instagram and you spend more time on Instagram than your classroom. I know that. Okay. Now in Instagram, I'm sure most of you will be following people like Sharon or others who are finance influencers. And they repeatedly tell you the importance of saving money. Because they say that if you save money, especially with smart choices like put money in mutual funds or stock market, and they tell you that over time, 10 years down the line, if you're saving 10,000 per day today, I mean, not per day, none of us can probably save 10,000 per day, 10,000 per month. 10 years, 20 years down the line, you will have 1 crore, 2 crore, 4 crores. How is that possible? Because small savings, and if the savings grow, it will have a compounding effect. Instead of thinking like I will start saving 20,000 per month after 5 years, right? If you start saving 10,000 today, you will have a bigger result at the end of 10 years than starting 20,000 per month 5 years later. This is what we call as compounding effect. See, this is one graph that will summarize what is the meaning of compounding effect, right? If you're starting today and if I make 1% improvement in whatever I do, study, sports, fitness, marketing, whatever is my profession, whatever is my task or function, if I achieve 1% improvement consistently daily, right? This is where I will land over time. On the other hand, if I stay however I am, right? This is where I will land. I will stay where I am. But if I have 1% decline in my performance, this is where I will land. This is the difference. Merely improving ourselves by 1% today, I will reach a different location, and merely by declining 1% of me today, I will reach a different position. So that's why I tell you, you might be very enthusiastic to start medicine in your final year and you may be able to study 5-6 hours a day on medicine. But trust me, if you start in the second year and spend 30 minutes a day, by the time you finish your final year, you will be far ahead of the person who will be studying 6 hours a day. This is what we call as compounding effect. 30 minutes invested on a subject today consistently will give you better result than 6 hours per day investment during your final year. So that is why starting second year in the second year itself is important. Second thing. So if I start studying today, there is a second added advantage. What is the advantage? You're relatively fresh from your understanding of physiology, biochemistry, and anatomy. What is medicine? Medicine is not a subject. I know many of my colleagues who are medicine teachers who say that medicine is an art, science, or something like that. Nothing. Medicine is not a subject. What is medicine? You learn physiology, that is the normal function of the body. Alteration leads to symptoms. As a physician, I identify those symptoms. I treat. How do I treat? I treat with the help of medicines, or I end up referring to a surgeon who decides to cut your body parts depending on his knowledge of anatomy, right? So ultimately, what is medicine? Medicine, you open any textbook. Harrison, you open it, you will see first it starts talking about physiology, then it starts talking about pathology, and then a little bit about diagnosis, little bit about management. Management is again full of pharmacology, right? So basically what medicine is, it is putting the knowledge of basic sciences together in patient care, right? Agree? So in that case, what is that extra I'm learning in medicine? Nothing much. Maybe I learn about the approach to symptoms. I learn about the investigation of choice. I learn about the treatment of choice. Everything else I've studied in pathology, pharmacology, physiology, biochemistry. If you start studying medicine right in the second year, then all the information that you have studied in first year, you start putting that into application. Okay, I studied about this ascending and descending tracts of the spinal cord in physiology as well as anatomy. Now, once I start going to the neurology, there you come across a chapter called localization of lesions in neurology, where you apply your knowledge of upper motor neuron, lower motor neuron, ascending tracts and descending tracts. So you achieve two things here. When you learned medicine, but at the same time you revised your physiology passively, you revised your anatomy passively. So now you will be able to hit MCQs coming in your NEET PG from your anatomy, from your physiology, as well as medicine. So this indirectly helps you in doing what I call as passive revision of basic sciences, passive revision of anatomy, physiology, and biochemistry. Right? Just to give you another example, if you open up myocardial infarction in medicine and you start studying about it, you will come across this term called as biomarkers, cardiac biomarkers, where you study about troponins, troponin T, troponin I, CKMB, LDH, right, AST, so many cardiac biomarkers. Don't you think this is also covered in your biochemistry? Open up any of your biochemistry textbooks and you will definitely find a discussion on cardiac biomarkers. So once you started studying about myocardial infarction in your second year, what happened? You were fresh from your understanding of cardiac biomarkers from biochemistry. Now you revised it. So now you know biomarkers better. So whether the question is framed by the biochemist or whether the question is framed by the physician, you will be able to deal with that. So that is the second advantage of starting in the second year. You will have the passive revision of anatomy, physiology, and biochemistry. And third, which is very crucial for today's generation, that is, we need to develop this habit of consistent reading, which is missing from today's generation. I won't say that our generation was like full of dedication towards study and all. हमने भी मस्ती की है, but we also you had some ability to prepare consistently, which I see missing in today's generation. And I'll tell you what is the reason. You know what is the reason? Because progressively our current generations are getting addicted to consumption of information in short formats. Right? आज के generation, they can't watch a 20-minute YouTube video, even educational, forget educational, entertainment videos also, they can't watch consistently for 20 minutes. They get bored because they're addicted to consuming the information or entertainment in short bits of 30 seconds or 1 minute from Instagram Reels or YouTube Shorts, right? 1 minute YouTube के बाद you feel like swiping, right? Or you feel like exiting YouTube and going back to Instagram. So progressively we have conditioned our brain to consume data, information or entertainment in shortened formats. But MBBS तो test match है भैया. It is not your T20, right? यहाँ पे छक्का चौका से काम नहीं चलेगा, आपको सेंचुरीज बनाना है मैदान पे बने रह के consistently. So you develop that consistency, right? Which is extremely important for your generation. You need to have that consistency. You need to have that ability to sit in front of screen, sit in front of teachers, sit in front of books together for hours, not for 5 minutes, 10 minutes, फिर बोर हुआ उठ के चला गया. ऐसे तो MBBS नहीं हो पाएगा, right? So you can train yourself to acquire that ability to sit with books, apps, screens or teachers for a long period of time. अगर अभी से start किए, every habit is trainable. There's nothing which is untrainable, right? You can train yourself to be able to achieve this. That is the third benefit. And then there is a fourth benefit. What is the fourth benefit? I think most of you know that exam may transition into what is called as national exit test or next. जब next आ जाएगा, then you all know that your scores in first MBBS, second MBBS, third MBBS don't make sense. Ultimately, what you score in the next makes sense. And I think most of you have gone through the original draft which was initially proposed. उसके बाद में exam नहीं हुआ है. Date is like exam, which year, which batch it will be done. It has become like a football. पता नहीं कब होगा, but इतना तो clear है. Government probably thinks that they will be doing the next on major subjects. Next will comprise of medicine, surgery, obgyn, ENT, ophthal, pediatrics, anesthesia, radiology. These are the subjects which will be testing you. And the scores that you achieve in these subjects are the ones which will give you a seat, which will give you the recognition for your medical degree or registration, and not how much you score on your university papers. And I think most of you have cracked NEET UG and you attempted IIT JEE and then you come here. So you know, right, when you are preparing for NEET UG or IIT JEE, did you focus on your 10th grade? Did you focus on your 11th grade or 12th grade? No. What was your focus? हाँ, NEET में इतना score निकालना है, IIT JEE में इतना score निकालना है. That was your focus, right? You never bothered whether you got 80% in 12th board or you got 60%, right? People with 60% have got single digit ranks in NEET UG. People with 90% haven't qualified to get into the MBBS. So you know that, राइट. सो सेम प्रिंसिपल अप्लाइज हियर. आपको रेडियोलॉजी मिलेगा या नहीं, इट इज नॉट बेस्ड ऑन हाउ मच यू स्कोर इन योर यूनिवर्सिटी प्रॉफ एग्जाम, इट इज बेस्ड ऑन हाउ मच यू स्कोर ऑन योर नीट पीजी और नेक्स्ट. और जब नेक्स्ट आएगा देर इज अ मेजर वेटेज गिवन टू क्लिनिकल सब्जेक्ट्स और मेडिसिन. मेडिसिन से कितने मार्क्स आने वाले हैं नेक्स्ट में? when next comes into picture, according to current draft, you will be getting 120 questions, right? 120 questions. So those who are in second year or third year, there's a possibility that you may land up with next or next aayega. So in that case, medicine is going to have 120 questions or 120 marks. छोटा नंबर बिल्कुल भी नहीं है, because the only two other subjects which will have 120 marks is OBG and surgery. Pediatrics will have 60%. Pediatrics will be in medicine, I guess. Yeah. So 60 marks is for ENT, 60 marks is for ophtha. So when that is the case, right? When that is the case, don't you think medicine deserves extra attention from your side? Not just that. See, today's NEET PG, when you look at the MCQs, you get around 20 to 25 questions from medicine. Maximum 25 questions. When you look at FMG, you get around 30 to 35 questions. So as an examiner, if I have to pick up 30 to 35 questions from medicine, then every probability is that I will be testing you on the common repeatedly asked topics. Cardiology जाऊंगा तो probably I will ask you about MI, I will ask you about heart failure, I will ask you about some common valvular heart diseases, maybe I will ask you about some cardiac biomarkers. These are like JVP common templates. But the moment exam flips and becomes a 120 marks paper, as an examiner I won't have choices to restrict myself to common topics. मुझे questions निकालने पड़ेंगे from rarer topics. So those topics which we have a tendency to ignore now will start becoming important. Questions will start coming from uncommon, rare, not so routinely tested topics. So all the more we need to spend time on medicine, right? So please remember, questions may come from rare topics. Also, once we need to set the question paper for 120 marks. There is no way I can restrict myself to common simple topics if I have to make a question paper of 120 marks. So these are the important reasons why you should start studying in the second year itself. अभी तक start नहीं किया, you're already in third year, time अभी तक हाथ से गया नहीं है, that is better to start. Once you're in fourth year, you have very limited time. Medicine तो खत्म होना बहुत मुश्किल है. You have to concise your sources. You have to give up on Harrison, switch to Davidson, नहीं हो पाएगा, switch to some simple Q&A books, नहीं हो पाएगा, then switch to rapid revision. But with rapid revision or concise sources, your conceptual understanding will be minimal. And when you don't have a conceptual understanding, problem क्या होगा? The biggest problem is that we know that questions are becoming clinically oriented. So if it is one liner, you may be able to hit, but the clinically oriented question जहाँ पे multiple levels of decision making and diagnosis होगा, you will not be able to deal with that. So better होगा कि start now. Otherwise in the end you will become like my many other students who decided कि हाँ medicine नहीं हो पाएगा, we will quit it. Medicine छोड़ के बाकी subjects पे concentrate करेंगे. But that might make you regret later. Either you will become a substandard doctor because you can't manage fever, sugar and hypertension, or else you will land up in a specialty or in a college which you don't like. नहीं पहुंचना वहाँ पे तो medicine अभी से start करो. Okay. So I hope I have sufficiently convinced you why we should start the medicine in the second year itself. Let me remind you again, compounding effect. आधा घंटा हर दिन आज से start करोगे, you will be in a better position than a person who starts in the final year and starts spending 6 hours a day, right? So now let us pledge that we will be giving 30 minutes per day for the subject of medicine. Okay. Now that we have agreed कि हाँ मेडिसिन स्टार्ट करना है, सेकेंड ईयर से ही करना है, नहीं तो थर्ड ईयर से करना है, सेकेंड ईयर से नहीं हुआ है तो अगेन डोंट थिंक दैट ओके आई एम इन सेकेंड ईयर, सर ने बोला सेकेंड ईयर या थर्ड ईयर से कर सकते हैं, सो आई विल चिल इन सेकेंड ईयर एंड देन विल स्टार्ट वंस आई गो टू थर्ड ईयर. नहीं, सेकेंड ईयर में हो तो डिसाइड कर लो कि हाँ आज से अभी से स्टार्ट करना है. सेकेंड ईयर में नहीं हो, थर्ड ईयर पहुँच चुके हो तो अभी से स्टार्ट करना है, फाइनल ईयर पहुँचने तक वेट नहीं करना है. ओके. नाउ once we have convinced ourselves that we have to study medicine from the second year, the question is what should be my source? See, you talk to most of your teachers in medicine, be it the NEET PG teachers through various apps, platforms, or your medical college teachers. एक आंसर स्टैंडर्ड आएगा, Harrison. Harrison is the Bible of medicine, पढ़ लो. You ask them a question in return. Sir, how many times you have finished Harrison during your UG? सच बोलता हूँ, मैंने तो बिल्कुल नहीं की. Probably I wouldn't have finished even Davidson during my undergraduate days. Did I finish Harrison in my postgraduate days? Probably no. I would have left many topics untouched. Have I finished Harrison now? Maybe, I don't know, but I wouldn't be confident to say that yes, I finished all the topics in Harrison. क्यों? इतना बड़ा है, difficult है finish करना. Then, do I really need to do all the topics from Harrison? The answer is big no. So please don't be under this FOMO that Harrison नहीं किया तो medicine नहीं किया है. बिल्कुल नहीं है. Harrison is a good resource, but it is not meant for everyone. It is not meant for every exam also. It is meant to prepare a doctor to be a physician. NEET PG के लिए नहीं है, आपकी UG prof exam के लिए नहीं है. It is not meant for FMG. And I sometimes say that it is not meant for even NEET SS. It is meant for preparing us to be a good physician. But जो physicians है market में as teachers, examiners, they have all studied from Harrison to some extent. So they have a tendency to ask questions from the Harrison itself. So that's why we should definitely keep Harrison in our armamentarium. लेकिन please let me remind you, you shouldn't be studying everything from the Harrison's principles of internal medicine. I will help you to navigate through this vast resource. कौन से topics important हैं, कौन से topics detail में पढ़ना है, कौन से topic को कहना है bye bye from Harrison. We will do that. We will do a separate session, read Harrison with Dr. Patil, and in that we will discuss individual topics. क्या क्या points important है, क्या क्या नहीं है. Okay. But yeah, Harrison is still an important resource. Second, theory के लिए मुझे कौन सा और resource important है? I think Davidson is a logical next alternative. Davidson's internal medicine. But if you ask me, sir, Davidson concise है compared to Harrison, but I want a better resource than Davidson. Suggest me one, right? I would suggest दोनों को गोली मारो. There is a textbook called as API textbook of internal medicine. API stands for Association of Physicians of India, and API textbook of internal medicine, according to me, is a best undergraduate resource. जो major portions या points that need to be covered, which is there in Harrison, is also there in API textbook of medicine. But unnecessarily, there is no beating around the bush. Harrison tries to give you the whole concept, and in the process, he does a lot of beating around the bush. जो जरूरी नहीं है वो भी बताता है, right? He goes on talking about numbers, like when it comes to epidemiology, what is important for us as an undergraduate student? Maybe I need to know the gender disparity, whether more common in males or females. Sometimes thought about ratio. What is the ratio of male-female occurrence? Maybe which community or which geographical area it is more common, right? That's all. Gender, geographical area, age group, that's all. But Harrison goes on talking about the prevalence among males is 1.2%, prevalence among females is 1.5%, among Asians it is 0.8%, among Europeans it is 1.5%. Numbers makes no sense, right? Numbers से भाग के ही तो MBBS करने आया है. We didn't want mathematics, इसलिए we have landed here. उतना सब याद रखना impossible है, but more importantly, if you read through that, you're unnecessarily loading your brain with unnecessary information, and that information will reduce your strength or ability to concentrate on other essential information. That's why I would say that जितना हो सके हैरिसन से दूर रहो, सेलेक्टेड टॉपिक्स ही हैरिसन से पढ़ो, बाकी सब यू कैन डू इट विद एपीआई टेक्स्ट बुक ऑफ इंटरनल मेडिसिन. और उनमें से आप में से कुछ लोगों को लगता है कि हाँ ये इंडियन टेक्स्ट बुक है, नहीं चाहिए मुझे तो इंटरनेशनल चाहिए, तो है डेविडसन आपके पास. ओके, दीज आर द रिसोर्सेज दैट आई रेकमेंड फॉर theory. Okay, now practical is an essential step, because ultimately why are we becoming doctors? We are becoming doctors to help our patients deal with their disease, and सबसे पहले before patients we have to deal with our relatives, right? अपने second year MBBS पहुंचा नहीं, relatives will come with complaints to you saying that मेरा सर दर्द हो रहा है, नाक बह रहा है, लूज मोशन हो रहा है, and they expect you to start addressing them. कॉन्फिडेंटली एड्रेस कर सकते हो, नहीं मुश्किल क्या है, ओके लूज मोशन है, कुछ सजेस्ट कर दिया और गलती से कुछ और साइड इफेक्ट हो गया तो फिर टेंशन स्टार्ट हो जाता है, राइट? वी डोंट वांट टू पुट आवरसेल्फ इन दैट सिचुएशन. देन वी हैव टू हैव द कॉन्फिडेंस. कॉन्फिडेंस आएगा कैसे? बाय अंडरस्टैंडिंग द डिसीज प्रोसेस. disease process understand करने के बाद to apply that to practical scenarios, we should have more and more patient exposure, right? And to be able to make most of the patient exposures, we should know the basics of physical examination, history taking and diagnostic algorithms. अब ये कहाँ से पढ़े? My suggestions are, I know most of you are big fans of the physical examination book by Archit Bolur, and I would second that it is a very good book. If you're purchased and relying on it, you can definitely rely on it as an undergraduate student. और alternatively जिनको थोड़ा सा और डिटेल में जाना है, I would suggest Arup Kumar Kundu. Arup Kumar Kundu. The advantage of Arup Kumar Kundu is you get the book addressing a question and answer format. Because it is addressing the question and answer format, I guess most of your examiners are also going to ask similar questions in your practical exam. They will ask you what is the most common cause for what is the most common cause for mitral stenosis. Then they will ask you, right, tell me about the non-cardiovascular manifestations of mitral stenosis. These are standard questions that our examiners have been asking for ages now. And all those questions, instead of giving it as a prose, he frames a question and gives the answer. So that gives you an ease to vomit out those answers in front of the examiner. So makes it easy for you to deal with your practical exam. But there is a problem with both these books. What is the problem? These books do not show you the examination methods. They will tell you, this is how you should do the examination. But if I could understand everything by reading, right, then why do I need to go to medical college? Not required, right? I can read, give a distance examination and get the MBBS degree, but not allowed. Why? Because reading and doing it in real is a different game. So I need to learn to practice those examination findings that we study, right? How to look for the raised JVP, how to measure the JVP, how to look for the apical beat, how to look for the pallor. Trust me, during our days, 1/3 of the students used to get failed because they didn't know how to look for pallor. And I'm sure, आज भी अगर I become an examiner, I can fail many of the students simply because they don't know how to look for pallor, how to look for icterus. These are common mistakes. Okay. So now your question is, where should I look for the resources? From which source I can study the examination methods, right? So my recommendation is, there are a lot of YouTube channels. I would suggest that YouTube channel called by Medical Snippets by Shaurya Acharya. It's a very good source. As an internal medicine practitioner, I would strongly recommend this. You can go through these videos. You want anything, right? You want to see a patient with dancing carotids, search it in YouTube. Most likely YouTube will recommend one of the videos listed by Shaurya Acharya, and I am very sure it will be a beautiful demonstration of the dancing carotids. You want to see locomotor brachialis, search it in YouTube. There is every probability that in first 5 or 6 videos, there will be one video posted by Shaurya Acharya. It's a good resource for practical. And then there is also Stanford Internal Medicine. That's a YouTube channel. They also do a lot of case-based discussions as well as demonstration of examination findings. They are good resources. Now, the only problem is to put everything together into your practice with 30 minutes or 45 minutes that you're devoting to medicine is very difficult, right? So then you might ask me, sir, give us a solution which is simple. And that is why I'm here today. So I want to talk to you. I want to understand what are the lacunae that you face in learning medicine today. I'm sure in the second year, most of you have got your internal medicine bedside postings. You started going to wards. You started interacting with the patients. कुछ ना कुछ सीखा होगा. अगर कुछ भी नहीं सीखा है तो एटलीस्ट बात करना सीखा है. पेशेंट से जाके नाम कॉन्फिडेंटली पूछ सकते हो, कहाँ से आए हो, व्हाट्स योर एज, व्हाट्स योर जेंडर. These things you can decipher, right? इतना तो आप कर सकते हो. So now you might have recognized that, okay, these are the roadblocks which are stopping me from learning medicine. So let me know those roadblocks so that we can come out with solutions for that. I'm having something in my mind for helping you to navigate through Harrison. जो मेरे साथ हुआ आज, I had to navigate through this complex roads of Hyderabad to reach the studio. आपके साथ ना हो. So I'm here to help you smartly navigate through Harrison. You don't need to waste time unnecessarily on the unwanted topics of Harrison. एट द सेम टाइम जो टॉपिक सिर्फ हैरिसन से ही पढ़ना चाहिए, अदर सोर्सेस आर नॉट suitable or sufficient, वो टॉपिक्स मैं आपको बताऊंगा and we will discuss those topics in the YouTube sessions in the upcoming weeks. So starting from 8th of April, I want to do a session which we will be titling as Read Harrison with Dr. Patil. And in that, we will take up important topics from Harrison one by one each session. And we will address what are the important points, what are the learning messages from the topic. And I will also bring in 1 or 2 MCQs, ताकि clinical practice, theory exam, as well as your NEET PG next preparation is covered from that topic. But if you find that okay, there are other lacunae, practical takes in ho pa raha hai, there is nobody teaching me bedside methods or mannerisms, there is nobody engaging us in the case discussion, so let me know those lacunae so that we can brainstorm and come out with some solutions for addressing those lacunae. Okay, now before I go on to sign off, let me also tell you what are good resources for your NEET PG preparation. नंबर 1, हमारे ज़माने में नीट पीजी प्रिपरेशन होता था विद द हेल्प ऑफ एमसीक्यू बुक्स, बट आई डू अंडरस्टैंड एंड अग्री दैट this is a different generation. This is a Gen Z generation which is moved away from books and moved on to screens. So nowadays most of us prepare from the apps, right? And obviously when you're preparing for apps, having spent almost 8-9 years and having spent lot of labor, literally burning the midnight's oil to record the new versions of videos, I would suggest that the PW Medit is a good source for your medicine subject and similarly for all other subjects. So the resource for NEET PG preparation I would suggest is PW Medit. So in the Medit, in the version 2.0, we have 2000, we have 218 video modules under medicine, which encompasses everything you need for NEET PG or next, and you can use the same resources to crack your final prof medicine exam also. Okay, and we are definitely coming out with specialized dedicated notes along with these video modules. And personally, I'm very happy with the notes in version 2.0. I was not so happy with the notes in version 1.1, 1.0 because they're kind of messy until and unless you watch the video and then go through the notes simultaneously, they were not making sense. But the notes that current team has prepared, they are phenomenal. You can, I would say that you don't need to watch the videos most of the times. Just navigate through the notes. Half of the topics you will be able to understand then and there from the notes itself, and maybe you don't need to waste your time on the videos. जहाँ पे समझ में नहीं आ रहा है, only on those topics you can go to the section of videos. And I would say that these notes can be used as alternative to George Matthew or the Q&A book that you are using from Dr. Archit Bolur. They can be substituted with the notes itself. Okay, so that's what I had for today. If you have any queries, let me know. I am in the hurry-burry. I missed my spectacles, so I have little visual difficulty. But I'll try to read your comments or your queries. Okay, so people are talking in Kannada. Okay, I am pleased that you people are talking in Kannada. Nimdu yav college, yav uru nimdu bro. Okay. Good. Okay, so listen guys, the last take home message from my side here is start early. Early starters are the biggest winners. To go back to the interviews published by various apps and platforms of previous NEET PG toppers or INI CT toppers and talk to their batchmates, you'll realize one thing. It is not that they started all of a sudden in the final year or internship, they got crazy about the entrance preparation and they started preparing. No. Majority of them, 80% of the people getting ranks of single digits were consistent preparers. They did well in their first MBBS, they did well in their second MBBS, they did well in their third MBBS, they did well in their final MBBS. They were preparing consistently. So consistency adapt karo abhi se, and trust me, you will thank me once you finish your final prof, NEET PG or next, and you will remember this day that sir told consistency is the biggest weapon to crack any exam. You will relate to this point. And those who do not start early, right, you will also relate to this point. You will regret later that काश मैंने तभी start किया होता when sir was telling, everyone was starting, मैंने देर कर दी, अभी तो बिना खाए, बिना सोए, बिना पिए पढ़ रहा हूँ, फिर भी I am left behind. Don't go through that experience, start early. And please don't miss out on letting me know what are your lacunae, what other things that needs to be addressed with respect to your preparation of subject medicine. You need help for practicals, you need help for case discussion, you need help for writing the answers in your final prof, whatever is the lacuna, let me know in the comment section. I will make sure to go through them, as well as my team will go through them, and we will try to bring out some solution for that. For now, to address your theory preparation, to make it easy for you to navigate through Harrison, we are launching a session, a series of live videos called as Read Harrison with Dr. Santhosh, just like how Dr. Ranjit is doing a session for Robbins. We will be able to navigate through most of the Harrison. In a period of 6 months from now, we would have completed all the major topics that you need from Harrison. So please stay connected with this PW Meded channel, and we will be navigating through the Harrison with ease. Okay, so I'm signing off, guys, and I will be looking for your comments. Let me know what are the areas that needs to be addressed. Bye bye, guys. Have a good time.